Good afternoon,
Araw po
everyone.
muli.
Welcome to our LAMP webinar. As usual, we start with blood. And here's Ma'am Mildred, CA. Good afternoon, Ma'am Mildred.
Magandang araw po muli, Doc. Magandang araw po mga classmates. Ang ating pumuling topic ay ang swe or blood. Number 30 na po tayo. Ito po. Scarlet red tongues. This tongue body color is deep red with slight pink hue. If tongue is dry or without coating, ang meaning po nun ay kidney deficiency with vigorous internal heat. Occasionally, only some areas of the tongue will present with this shade. So, most commonly, nasa anterior third po ng tongue nakikita. Kasi andun nga yun yung kidney. Kidney organ nakikita natin sa dulo. This coloration corresponds to severe lung yin and stomach yin deficiency. Scarlet red tongues with coating are characteristic of warm febrile diseases. So ito po yung case natin, female, 22 years old. Yung tongue description po niya, ayan po yung scarlet red. Tingnan po natin. Dry po siya, wrap din yung coating. Nuts at the tip. So yung symptom po ay dry, red, and itchy skin. Fits of anger. Tapos depression. So yung Western diagnosis po, meron siyang atopic eczema. Yung background of disease po, kunti pantulog niya. Irregular lifestyle. Siguro gusto niyang kumain, kakain, kung hindi, hindi. Alcohol abuse. Yan. Yung TCM diagnosis po niya, heat in the blood. Kasi nga yung eczema, nakita talaga doon. Slight kidney deficiency at may fluid deficiency po siya. At meron siyang slight heart blood deficiency. Kasi hindi nga siya natutulog. So, male, another case po natin, male, 33 years old. Yung tongue description, ayan po uli, ang scarlet red. Race, reddish dots, yun, may mga parang tusok, paltak-paltak na red. Distributed over entire tongue. Ayun po maliliit oh. So, long vertical cracks, yan po sa gitna. So, yung symptom po niya, inner restlessness. Tapos nagkakaroon po ng tremor of hands, nanginginig. Mahina rin ang kanyang memorya. Pwede siya makalimot. So, Western diagnosis po, wala. Background of disease po, drug abuse. So, gumagamit po ito ng mga kung ano-ano pong cocaine, ecstasy. Lack of sleep. Tapos overwork din po siya. Work with toxic substances. So yung TCM diagnosis po ay kidney yin deficiency siya sa blood at constitutional weakness of the heart. Meron din po siyang heat in the heart. So, nakita natin sa tongue. So yung red short tongue po, this tongue type indicates severe exhaustion of kidney and liver yin, plus development of vigorous heat. So this can lead to very serious disorder po as extreme heat consume fluid and yin. So most serious being internal movement of wind. Pag tongue is short po, dahil nga yung fluids, yung blood, fluids, blood, yin are not adequate. Kasi yung blood, andun din yung fluid syempre. Hindi po sapat upang inorish yung tongue muscle, kaya liniit. So tongue loses its elasticity and its ability to move freely. Kaya matigas din po yan. If tongue deviates to one side, so nagsasabi po to na may internal wind na ang katawan. So although this type of tongue is a result of severe yin deficiency, treatment with pure tonification is not indicated. So hindi lang po dapat itonify mo, kundi dapat internal wind must be extinguished and yang sedated. So kailangan mong tanggalin yung hangin at isedate yung yang. So tongue is short. Ay, ayun pala. Next case po natin, female, 19 years old. So yung tongue description po niya ay red, small, and short. Yan. Very pointed prickles at tip. Intense red edges. So symptom po, lack of appetite. Wala siyang ganang kumain. May constipation siya, may amenorrhea siya. Strong inner restlessness. May insomnia at suicidal fantasies. So, Western diagnosis po, anorexia nervosa. Yung background po sa disease, serious starvation. Dahil divorce din po yung kanyang parents. So, grabe yung emotional stress niya. TCM diagnosis po ay kidney deficiency. Onset of essence deficiency. So, yung essence na po nagkukulang na. Tapos, meron siyang heart fire at heat in the liver. Kasi yung emotion, sobra. So, yun po. Thank you.
Thank you very much, Ma'am Mildred. We will now go to tongue diagnosis. Let's welcome Ma'am Teresita Sumile. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis, and now let's talk about uneven sides of the tongue or swollen on half of the tongue. Nutritive qi flows with the blood. Together, they nourish organs, muscles, tendons, sinews, and circulate and fill channels and collaterals. Qi and blood deficiency presents not only with a pale tongue body, but also with uneven sides of the tongue. These tongue signs represents impaired circulation of qi and blood in relation to the right or left half of the body. Again, the affected side of the tongue does not necessarily correspond to the affected side of the body. The same interpretation obtains when only one half of the tongue is swollen. In this case, the swelling shifts the midline of the tongue. Symptoms associated with this type of tongue are weakness in one half of the body and lack of strength or stamina in one arm or leg. Occasionally, this type of tongue will be seen in atrophy disorders. Now let's go to our patient, female, 35 years old. Tongue, as we can see in the tongue picture, the patient has a pale tongue body color, uneven teeth marks on the left side, and has light yellow greasy coating. Symptoms presented by the patients are sharp pains in the left hip upon insertion, lack of mobility of the hip joint, extreme muscular tightness of the quadriceps, acute stomach ache, and loose stools. Western diagnosis, bilateral degenerative joint disease of the hip, and then background to disease, excessive consumption of spicy foods, kaya pala lack of exercise, and she took opiates during pregnancy. Okay? Then TCM diagnosis, spleen qi deficiency, lack of nourishment in the channels and collaterals due to qi and blood deficiency, and acute food stagnation. Okay? Next is female, 30 years old. The tongue of the patient is pale and the tongue body is with slight teeth marks. And the center is swollen and it has uneven sides to the tongue. Okay. Now symptoms presented are tendency to catch colds, fatigue, blocked nasal passages, a runny nose with copious white discharge, fullness in the epigastrium, feeling of weakness on the left side of the body, and feeling cold. Background to disease, excessive physical exercise in connection with dancing competition, irregular eating habits, excessive consumption of dairy products and chocolate. DSM diagnosis: spleen yang deficiency with accumulation of dampness, phlegm obstructs the stomach, lack of nourishment in the channels and collaterals due to qi and blood deficiency. Okay, yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we have diagnosis by interrogation. Let's now call on Ma'am Vina Pasqua of Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon sa lahat. So, ang mental emotional symptoms, day 11 na po. At ang topic natin ngayon ay sadness and grief. Sadness, which pertains to the lungs, must be distinguished from lack of joy, which pertains to the heart. Sadness is an emotional state na pinapahina po ng ating lungs and usually manifest with lung-related symptoms such as pale ang complexion and parang naiyak at mahina ang boses. Lack of joy, on the other hand, is not an actual emotional state but a certain lack of vitality deriving from heart deficiency. And this manifests not only with a sad demeanor, but with a flatness and lack of fire. A patient may report a feeling of sadness or may be unaware of it. A full or empty quality on the lung pulse is usually ang most reliable indication of whether sadness is involved in a presenting condition. Sabi ng author, I find that a full lung pulse often indicates sadness which has been held on to for a long time by the patient. So parang kinikimkim niya, who may be totally unaware of its presence. When the lung pulse is weak or empty, sabi niya, yung patient more likely to report feeling sad. So, ano siya? Sadness, nadideplete po yung lung and heart qi. However, with time, the deficiency of qi in the chest also may give rise to some stagnation of qi in the chest. Itong stagnation na ito is associated with the lungs and heart and not the liver. It manifests with a slight feeling of tightness of the chest at nakakaramdam ng patient ng sadness in the chest, sighing, and slight palpitations. The most likely empty pattern giving rise to sadness are a deficiency of lung qi or liver o kaya heart blood. Pag yung lungkot is due to an empty condition, it is often accompanied by palagi po siyang umiiyak. Sadness from liver blood deficiency is more common in women and becomes worse after the period or after childbirth. Sadness with a feeling of lump in the throat may be due to lung qi stagnation. Grief naman, it is similar to sadness and usually derives from loss, separation, or bereavement. Gaya ng sadness, nagdideplete po ng lung at saka heart qi. But with time, it also may give rise to some stagnation of qi in the chest, causing symptoms similar to the ones mentioned above for sadness. So ito na po yung summary. Lung and heart qi deficiency, ang patient nagkakaroon ng manifestation po ay sadness, crying, depression, pale po ang dila at saka empty pulse. Pag liver blood deficiency naman, sadness, crying, mental confusion, aimlessness, pale tongue, choppy or fine pulse. Pag heart blood deficiency, sadness, crying, depression, pale po at saka manipis ang dila, choppy or fine pulse. Pag lung qi stagnation naman, sadness, so mild irritability, depression. Ang dila is slightly red on the sides in the chest areas. Pag yung pulse po ay very slightly tight on the right front position. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Next, we'll have pulse diagnosis. And we will have Ma'am Mildred for the presentation. Good afternoon po, Ma'am Mildred ulit.
Good afternoon po muli. Patuloy po natin ang ating pag-aaral. False diagnosis, number 94 na po tayo. Superficial falses. O yung Soggy false. Some sources term this false soft. So, this false image is describing Wang DNA, Ginsuwen, as being like a piece of silk thread lying on the surface of water. So, imagine po niyo, silk. So, ang nipis lang. This description is very apt. The pulse will be felt superficially. It is without strength and feels narrow when rolling the tip of the fingers back and forth. So the pulse will disappear when you press your fingertips downwards. The saggy pulse can be felt when there is Qi deficiency and blood deficiency. So combination na po ito, pag saggy pulse, Qi and blood ang deficient. At saka kung meron pong dampness. So the dampness will smoother the pulse as if it is wrapped in cotton wool. The Qi deficiency and blood deficiency, Suesu, will mean that the pulse does not have the strength to be heard through the dampness. So, maano po siya, masyadong mahina. So, yung saggy pulse pattern of imbalance po ay, pag naramdaman natin ang saggy pulse, ito po ay may dampness, tissue, and Suesu. Siya po yun ang ibig sabihin pag saggy pulse. So, typical combination, saggy and rapid. So, may damp hit po yan. Saggy and slow, damp cold. Next po is flooding pulse. So, pag flooding pulse naman po, the pulse is also translated as overflowing and surging. So, yung pulso pong ito ay nararamdaman when there is extreme heat. So, the pulse's name alludes to the sensation it creates. It is large, replete, wide, and superficial. Kasi flooding talagang pakalat. It is like a flood wave that overflows or tidal wave. So the pulses rises powerfully. So from the deep level, it hits the fingers with force in the superficial level. So malakas po siya, nararamdaman talaga siya. So the flooding pulse will often be experienced when exogenous Qi, yung Qi po, ito yung pathogens has penetrated down to the Qi level of the Yang Ming aspect. So, na-penetrate na po niya yung Qi. At this point, there will be a first struggle between Zheng Qi and Zai Qi, yung ating pong energy sa katawan at yung pathogenic naglalaban siya, kaya ganun po kalakas. This struggle will manifest with a very rapid pulse. At the same time, the exuberant heat that the struggle generates will increase the speed of the pulse so that it is quite fast. The heat is so intense that it forces Qi and Jinye to the surface and can be felt in the pulse. So, naglalaban kasi kaya malakas. The flooding pulse can start as a deeper or normal pulse in the Qi position. So, pwede po itong maramdaman sa Qi position na nasa ilalim na and increase in strength and width, rising upward so that when it reaches the Kun position, it is yung superficial po yung Kun wide and replete, so mas malakas na. Masyosha write that the overflowing pulse will sometimes only be felt in one position. In this case, the pulse position will feel very strong and full and superficial aspect related to other pulse position. This is a sign that there is heat in the organ or organs related to this pulse position. Halimbawa po, naramdaman nyo yung saggy pulse sa Kun position, maaaring yung lungs or yung pagsaray, yung lungs ang may heat. If the pulse is generally weak, but is relatively full and superficial, mahina pero nararamdaman po siya in a single position. So, nagmamanifest daw po ito ng yin deficiency, heat in this organ or organs. So, yung flooding falls po, yung pattern of imbalance, excess heat po siya. Or yin deficiency heat. So, thank you po. Yun po ang ating flooding falls.
Thank you, Ma'am Mildred. I'm sure our attendees learned a lot from the superficial pulses. Maraming salamat po. We will now continue with our webinar. This time, we will have differential diagnosis. Okay, let's call on Ma'am Neets, you. Again. Good afternoon, Ma'am Neets. Again.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc?
Clear po, very clear.
Thank you. So, today is in our TCM Foundations number 195. Our topic is wind cold invading the lungs. Okay. Etiology, exposure to exterior wind and cold, relative weakness of the body's chi in relation to the pathogenic factor. Sign and symptoms, aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose, with clear watery discharge, sneezing, occipital headache, body aches, absence of sweating, heavy voice. It may with throat, cough, absence of tears, okay? Pulse, when you palpate, it is floating type. Tongue, it is thin white coating. Treatment principle, dissipate wind cold, diffuse the lung and suppress cough. Acupuncture treatment, points, lung 7 releases the exterior, expels the wind. GB20 or gallbladder 20 expels wind, Feng Qi. DU16 or GB16 expels wind din kasi men use cupping, it expels wind and releases the exterior. SJ5, Sanjiao 5 expels wind, benefits the head. LI4 releases the exterior. Bladder 13 suppresses cough, regulates lung qi. Okay? Needle with drainage. So if there is headache, add DU20 or GB20 and SI3. Para sa absence of sweating, add kidney 7. For nasal congestion and running nose, add LI20 and extra point in tongue. For when there is cough, add bladder 13 and bladder 11. Thank you very much, everyone. Thank you, Dr. Hector.
Thank you very much, Ma'am Neets. Maraming salamat po. Next, we go to acupuncture patterns and practice. We are still on vertigo and dizziness. Okay, now let's talk about the acupuncture treatment for vertigo. Okay, if the etiology is hyperactive liver yang, you select bladder 18, bladder 23, GB20, liver 2, GB43. Use filiform needles and apply both reducing and reinforcing methods. So if the etiology is blockage by phlegm dampness, so we select stomach 8, PC6, CV12, stomach 40, and spleen 9. Use filiform needles, even method. If the etiology is insufficient kidney acids, select governing vessel 20, GB39, bladder 23, and kidney 3. Use the filiform needles and apply reinforcing method. Moxa at bladder 23 and do 20. If the etiology is deficient Qi and blood, select do 20, stomach 36, bladder 20, bladder 21. Use filiform needles, reinforcing. Moxa may be applied to do 20, stomach 36, and bladder 20. If due to blood stasis, we select the Ashi acupoints, bladder 17, spleen 6. Use filiform needles, even method. Now let's go to the case study. We have a patient, 33-year-old patient, married laborer. He suffered from paroxysmal vertigo for more than 6 years. Worse during the last 2 years. Each attack was preceded by a sensation of hot air rising from the lower abdomen to the vertex of the head. This was followed by vertigo with sensation of the surroundings revolving about him and dimness in front of his eyes. During more severe attacks, he would fall but retain consciousness. He was diagnosed at another hospital to have Meniere's disease and was treated with a variety of Western drugs. Each time he had good initial response, but the response gradually diminished. At the time of consultation, he had vertigo, tinnitus with partial deafness, forgetfulness, nausea, expectoration of sputum on arising in the morning, restlessness, bitter taste, constipation, dark urine, palpitations, and shortness of breath. He also had intermittent hotness in the palms and lumbar aches. He had a gray and lusterless complexion, tongue red with slight yellow and greasy coating in the middle, pulse deep and slippery on the right side and taut and thread-like on the left. Pulse rate was 80 per minute, regular in rhythm, BP 100/80. Cardiac border by percussion was normal. Heart sounds normal to auscultation. Abdomen and extremities normal. Urologic exam, bilateral horizontal nystagmus. Vestibular function test showed diminished function on the right side. Audiometry showed perceptive deafness. Treatment principle, nourish yin, cool heat, dissipate phlegm, purge fire. Thank you very much. Then we go to signs and symptoms. Let's call on Ma'am Vina Pascua to do the presentation. Again, good afternoon, Ma'am Vina, ulit.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, signs and symptoms, day 87, blurred vision and floaters po ang ating topic ngayon. Blurred vision, ang tawag sa Chinese ay, paki-check po, Doctor, Muzhuan, indicates not only blurring of vision and floaters, but also includes slight, medyo nahihilo siya. Although blurred vision is a relatively common complaint, pag tinatanong whether they suffer from it, most patients will either answer negatively or hindi po nila alam ang ibig sabihin. Thus, this question should be asked in a different way, such as ganito po. Ang tatanungin ay, do you have any problems with your vision? O kaya, is your vision sometimes unclear? Ganun po ang pagtanong. So first of all, it should be remembered that the eyes are under the control not only the liver, but also of the gallbladder and kidneys, especially sa may mga edad na. A kidney deficiency is often at the root of eye problems and blurred vision. Among the deficiency types, ang most common na sanhi po ng blurred vision ay liver blood o kaya liver yin deficiency. Pag yung blurred vision is associated with dryness of the eyes, it suggests either liver yin deficiency or liver and kidney yin deficiency. At again, this is common in the elderly. Blurred vision also may be due to excess patterns such as gallbladder heat, liver yang rising, a common feature in migraine, liver fire, and phlegm. Phlegm, in particular, is not often recognized as a possible cause of blurred vision. It may cause blurring of vision kasi it obstructs the clear orifices of the head, including the eyes, for the same reason. Phlegm may cause tinnitus or tinnitus. Meron pong tatlong Chinese terms that may be translated as blurred vision. So, hindi ko po alam basahin. So, the first is mu huzuan, mu meaning eye, in which the term yuan suggests also dizziness. The second is mu hun, han, in which the term han suggests faint feeling, yung parang nahihilo. And the third is mu hua, in which the term hua means flower, and the two terms together indicate that the patient sees objects that look like flowers. O kaya'y butterfly wings, that is flutters. This third term thus could be translated more specifically as seeing floaters. The Chinese term for blurred vision therefore also implies the symptom of dizziness. And there is a certain overlap between these two terms and symptoms. In fact, yung term for dizziness is yuan yun, yuan being the same character as in yuan, meaning blurred vision. Pakicheck na lang po yung ano. So, pag empty, liver blood deficiency, blurred vision, and or floaters, dizziness, numbness, or tingling of the limbs, scanty menstruation, dull pale complexion, ang dila po ay pale, at saka yung puso ay choppy or fine. Ang ginagamit po na acupuncture treatment dito ay liver 8, stomach 36, spleen 6, ren 4, LI 4. Then ito naman, liver yin deficiency, blurred vision and of floaters, dry eyes, diminished night vision, dizziness, dry po ang buhok, numbness or tingling of the limbs, insomnia, scanty menstruation or amenorrhea. Dull pale po ang complexion na walang luster but with red. Red po yung cheekbones, cramps, ang kuko ay withered and brittle, night sweating. Normal colored po naman ang dila without coating. So, fine or floating ang kanya, empty ang pulso. Ang ginamit pong acupuncture point dito ay liver 8, stomach 36, spleen 6, at saka ren 4. Then last po ay kidney yin deficiency. Blurred vision and or floaters, dry eyes po, dizziness, tinnitus, a hardness of hearing, poor memory, night sweating, vertigo, tuyo po ang buhang at saka yung lalamunan paggabi. Lower back ache, constipation, dark scanty urine, tiredness, normal colored tongue na walang coating, at ang pulso po ay floating empty. Ang gagamitin po dito na points ay kidney 3, ren 4, bladder 23, spleen 6, at saka ren 12. So, yan lang po. Thank you, Doctor. Again, thank you sa lahat.
Thank you very much, Ma'am Vina. Now we go to the last but not the least topic, BPH. And let's call on Ma'am Teresita Sumile for the presentation. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa BPH. Treatment na po tayo. Acupuncture treatment. When treating prostate problems, it is important to treat one of the 3 extraordinary vessels that flow through it, like the governing vessel, directing vessel, or penetrating vessel. The governing vessel is selected when there is pronounced deficiency of kidney yang. So this is an illustration of the extraordinary vessels and the prostrate, okay? The directing vessel is selected if there is a pronounced deficiency of kidney yin. The penetrating vessel is selected if there is a pronounced blood stasis. In all cases, use the opening of the coupled points of the relevant extraordinary vessel. In men, use the opening point on the left side and the coupled point on the right. Like for the governing vessel, use SI3 on the left and bladder 62 on the right. The main points used according to channel and patterns are as follows. Governing vessel if there is pronounced deficiency of kidney yang. Some SI3 on the left and bladder 62 on the right, do 20 and do 26. Directing vessel, use directing vessel if there is pronounced deficiency of kidney yin. Lung 7 on the left and kidney 6 on the right, REN 2 and REN 3. Then another is penetrating vessel if there is pronounced blood stasis. Spleen 4 on the left and P6 on the right and kidney 14. Then the liver channel, use liver 5, liver 1, and liver 3. Back transporting points, bladder 32, bladder 34. Dump phlegm, use stomach 40, spleen 9, spleen 6, bladder 22, stomach 28, REN 3, and REN 5. In blood stasis, use liver 3, spleen 10, bladder 17, kidney 14. In stasis of essence, use kidney 14 and REN 5. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. And
Thank you din po, Dr. Hector.
we would like to thank everyone for joining. We would like to express our heartfelt thanks to the presenters. Good afternoon, everyone. See you on our next webinar. See you next week. Good
Thank you, Doc.
afternoon.
Thank you po.